As the country continues to battle the opioid crisis, lawmakers on Capitol Hill received an update from states in their efforts to save lives. A North Carolina health leader testified. Spectrum News Washington Bureau reporter Kevin Fry has a look at what he had to say.
Federal funding is helping turn the tide on the opioid epidemic in the Tar Heel states. So says the Deputy Secretary with the North Carolina Department of Health and Human Services. Speaking before lawmakers today, he touted what he labeled successes while calling for further action. In recent years, North Carolina has been awarded over $100 million in federal grants to help manage the crisis. DHHS Deputy Secretary Cody Kinsley says they are using those funds for a variety of programs, from expanding treatment opportunities to making sure future doctors are trained to help those battling addiction. Kinsley says in 2018, North Carolina saw the first decline in unintentional overdose deaths in 5 years. But he warns different drugs could lead to a new wave.
Sustaining funding over longer windows of time or permanently would allow states to ready systems for the next wave of the epidemic. That wave is already cresting as we're starting to see rising rates of overdose deaths from methamphetamine and benzodiazepine.
Kinsley also pointed to Medicaid expansion as another tool that could help North Carolina in the fight. That issue has sparked a long-standing feud between the governor and the Republican-controlled State General Assembly. Congress has approved billions of dollars to help fight the opioid crisis in recent years, though some experts have said that's simply not enough. In a statement, Congressman Richard Hudson told me they have more work to do, noting, "I remain committed to working with our state partners to ensure folks on the front lines have the resources they need." In Washington, Kevin Fry, Spectrum News.